I'm Greg Bauer. I'm an orthopedic surgeon practicing at Goldsboro Orthopedic Associates. Shoulder complaints are the second most common musculoskeletal complaint next to back pain. And we see it in all different classes of things. We see it in sports injuries. We see it in accidents, meaning falls, car accidents, trying to lift something heavier than we should have, and certainly age in the degenerative process. And you see a wider range of things. You see problems with the tendons, you see problems with the joints. There's 17 muscles and tendons that work around the shoulder, and there's actually 5 different joint spaces. It's not just a ball in a socket, so it's pretty complex. So there's a lot of things that can go wrong with it. It depends on the individual problem. I mean, you certainly look at doing some exercises at home, modifying your activity. If you need the expertise of a physical therapist, we can certainly get you into the hands of a good one. We try different medications to try to address the inflammation, steroid injections if indicated, and last resort surgery. I tell patients that if you're satisfied, I'm satisfied. So even if you don't have full motion, but you're satisfied with your motion, then I'm satisfied. We only operate to treat 2 things. 1 is pain and 2 is function. But the biggest thing is pain. I don't want to be operated on if I don't have to be, so I'm not going to offer somebody an operation unless it's absolutely necessary. If you need a shoulder replacement, it's due to degeneration of your joint, and the biggest things are pain, stiffness, difficulty sleeping on your shoulder. You feel noises, clicks and pops and grinds. And this usually doesn't happen overnight. This occurs over a long period of time. If you need to have a rotator cuff repaired, you're usually in a sling for 6 weeks, and you start strengthening it at 3 months, and you still continue to actually improve up to about a year afterwards. By about 6 months, you're about 90–95%. There's been some big changes in our implants. We can implant them into the body now without having to use what's called bone cement, which to cement it into the bone, we can actually have the prosthesis have bone grow onto or into the prosthesis. We've changed how we handle the tendon in the front of the shoulder so that now I can have you out of a sling in 2 weeks when it used to have to be 6 weeks, so people can get moving faster. Really good story of a patient who was debilitated with both knee and shoulder problems. He was on disability, he couldn't work. I ended up replacing both of his shoulders and both of his knees, and at 65 he started a lawn care service. Yeah, he started a lawn care service after getting rid of his pain, and that's gratifying. The biggest thing they need to know is what their expectations are. Right up front, I have to tell them I'm putting in a man-made joint, not what God gave them. It is a substitute. It should function very well with them, but they also know that there are little differences. It's not like when they were 18. It's not going to feel the same. It's metal and plastic, not cartilage on cartilage, but it's going to be a lot better than the bone on bone that they had before the operation. There's a couple new materials coming out that is felt to wear in the body more like cartilage did against cartilage. So we'd be able to replace just the ball in situations and keep the patient's socket. Whereas in the past, metal on cartilage doesn't wear too well, and it wears down the socket very rapidly, and you have to replace both the ball and the socket. But there are some materials that are being tested now to wear more like normal tissue against the socket. The biggest reason to have a shoulder replacement is to get pain relief. I mean, that's the biggest thing. Pain changes people's lives. Difficulty sleeping can make you irritable, raises your blood pressure, raises your blood sugar if you're diabetic. And we've had patients get off of some of their blood pressure medicines or get off of some of their diabetes medicines, and we've been able to get rid of a source of their pain. It can really be a big deal for them. If it does come to surgery and that is a last resort, they can still have a good quality of life and function very well.